Mexico just announced universal free healthcare for 100 million people. And if you're an expat or retiree thinking about moving here, you need to hear this before you cancel your insurance. In 2026, the Mexican government rolled out what they're calling a universal health service, a plan to eventually cover nearly 100 million people. On paper, it sounds like a retiree's dream: free doctors, free medication, free surgery, no insurance companies standing between you and a hospital bed. There are three completely different systems: hidden exclusion lists that can deny you coverage for the exact conditions you're most worried about, and a bureaucratic maze that trips up even people who've lived there for years. By the end of this video, you're going to know exactly which system applies to you, what it actually costs, what it will not cover no matter how much you beg, and the exact hybrid strategy thousands of American and Canadian retirees are quietly using to get five-star healthcare for a fraction of the price back home. The three-tier system explained. IMSS, the Mexican Social Security Institute. This is Mexico's version of a national insurance system, originally built for formal sector employees. If you work for a Mexican company, you and your employer pay into IMSS automatically, and you're covered. But here's the part expats care about. If you're not employed in Mexico, you can still buy into IMSS voluntarily. It's called Seguro de Salud para la Familia, but almost everyone just calls it voluntary IMSS. This is the route most long-term expats and retirees use, and it functions almost like a low-cost national insurance plan. IMSS-Bienestar. This is the truly free safety net, the piece people mean when they say Mexico has universal health care. It's aimed at anyone who does not have formal Social Security, informal workers, the unemployed, and yes, foreign residents holding a valid CURP, which is Mexico's version of a national ID number. Private health care. Pay-as-you-go clinics and hospitals with or without a private insurance policy layered on top. And here's a fact that surprises almost every newcomer. This is what most expats actually rely on day to day. Not because the public system is bad, but because private care in Mexico is so good and so cheap by American or Canadian standards that many people just pay cash for routine visits. And now, layered on top of all three of these as of 2026, is the new piece, the Servicio Universal de Salud, the Universal Health Service. This is not a fourth insurance system, it's a coordination mechanism. Think of it like a translator that lets IMSS, ISSSTE, that's the system for government workers, and IMSS-Bienestar talk to each other and share patients, labs, and specialists across institutional lines. IMSS-Bienestar, the truly free option. Let's start with the system that gets called Mexico's free healthcare, IMSS-Bienestar. Here's the appeal. There is no formal enrollment, no annual fee, no premium. If you're a legal foreign resident with a CURP, you can walk into an IMSS-Bienestar facility and access primary care, consultations, and even surgeries and medications at no direct cost. Sounds incredible, right? Now here's the reality check that most videos conveniently leave out. Reality check number 1. Infrastructure varies wildly by location. IMSS-Bienestar was built by absorbing existing state hospitals and rural clinics into one federal system. That means in a major city, a Bienestar hospital might be a massive, well-equipped facility capable of serious trauma care. But in the small coastal town or rural mountain village where a lot of retirees dream of settling down, the local Bienestar clinic might be a tiny building that can handle a sprained ankle and not much else. Reality check number 2. This is a safety net, not a retirement plan. Most expats who've actually lived this system describe IMSS-Bienestar the same way. Good to have, not something to build your entire healthcare strategy around. It's there if you need basic care and have nothing else. It is not the system serious long-term expats are using as their primary coverage. So who is IMSS-Bienestar actually good for? If you're on a tight, fixed income, living somewhere with a decent-sized hospital nearby, and mostly need routine primary care, this can genuinely work. If you have a chronic condition, want a specific specialist, or you're settling somewhere remote and scenic, you need to look at the other two lanes. Voluntary IMSS, the one most expats actually choose.
This is the section I told you about at the beginning. Pay close attention because this is where retirees that blindsided. Voluntary IMSS, officially Seguro de Salud for la Familia, is what most expats mean when they talk about getting on IMSS. Here's how it works. Eligibility. You must hold legal residency, either residente temporal or residente permanente. If you're in Mexico on a tourist FMM permit, you flatly cannot enroll. This trips up more people than you'd think. Retirees who move down, love it, and try to sign up for IMSS before they've actually converted to residency status. You'll also need a CURP and a valid passport. When you apply for voluntary IMSS, you must declare any pre-existing conditions, and IMSS will flatly refuse enrollment or deny coverage related to certain conditions, including malignant tumors, congenital diseases, chronic degenerative diseases like diabetes with complications or kidney failure, COPD with respiratory failure, addictions, mental illness, and HIV. Other conditions aren't outright excluded but come with waiting periods, sometimes 6 months, sometimes up to 3 years before IMSS will actually treat something related to that condition. Let that sink in for a second. If you're a retiree with a manageable but existing chronic illness, which, let's be honest, describes a huge percentage of people retiring in their 60s and 70s, voluntary IMSS may not cover the exact thing you most need covered. This is the single biggest myth about Mexican healthcare that trips up new arrivals. They assume insurance works the way it does in a place with guaranteed issue policies. It doesn't. What voluntary IMSS also does not cover, even without pre-existing conditions, is eye care, dental, elective and cosmetic surgery, infertility treatment, and, critically, medical evacuation out of the country. If you need to be airlifted somewhere for advanced treatment, IMSS doesn't pay for that flight. Private healthcare. Why most expats actually use this. Here's the twist almost nobody expects going in. The majority of expats living in Mexico today are not primarily relying on either of the free public systems. They're paying cash for private care because it's genuinely that good and that affordable. And the prices will genuinely shock you if you're coming from the US. A routine doctor's visit might run you the equivalent of $30 to $50. A specialist consultation may be $60 to $100. Even significant procedures and hospital stays tend to run a small fraction of equivalent US pricing. We're often talking 70, 80, sometimes 90% less for comparable private care. For monthly private insurance premiums, local Mexican plans typically run somewhere around $100 to $300 per month, while international plans with broader worldwide coverage run higher, roughly $300 to $700 per month, depending on age and coverage level. What about Medicare and Canadian coverage? This is one of the most important and most misunderstood pieces of the whole puzzle, especially for American retirees. U.S. Medicare in almost all cases does not cover you outside the United States. Full stop. If you're 65 and planning to retire in Mexico expecting your Medicare card to work at a Mexican hospital, it generally won't. There are some very narrow exceptions involving emergency care near the border, but as a rule, don't plan around Medicare covering your day-to-day life in Mexico. Canadians face a similar situation. Provincial health plans generally do not extend coverage outside of Canada either, and most provinces will only reimburse a small fraction of costs incurred abroad, if anything. So, Canadian retirees moving to Mexico are in essentially the same boat. You need either IMSS, private insurance, or a serious travel or expat medical policy because your home coverage is not coming with you. The new Unified Health ID card, what it actually changes for you. Here's what it is. Essentially a portability tool. The idea is that no matter which public institution you're registered with, IMSS, ISSSTE, or IMSS-Bienestar, this card is supposed to eventually let you access services across all of them, instead of being stuck if your specific system doesn't have what you need in your specific location. Here's what it is not. It does not replace your existing enrollment. You still need to be enrolled in one of the underlying systems, IMSS, ISSSTE, or IMSS-Bienestar, to use it.
Think of it less like a new insurance card and more like a master key that, once fully rolled out, lets your existing coverage open more doors. For foreigners specifically, foreign residents holding a CURP are eligible to register for this card. Registration modules are open Monday through Saturday, and you'll need government-issued photo ID. Your passport or residency card works for this.